Hey guys, I'm Marcos and I'm here to talk about an injury to the AC joint. So first we're going to start off with some anatomy of the shoulder just to go about the picture that I drew here. So first this is the humerus, this is the scapula, and here is the clavicle running across the top here. And then getting into the ligaments, we have the coracoacromial, which is ligament that comes across the coracoid, and the acromion process here connects these guys. The next ligament is the acromioclavicular, and there's two of them. That one runs from here to about this head of the clavicle. So this is the coracoid here. We have one that runs this way, trapezoid, and then one that runs this way. Two of those. And then lastly is the major ligament that we're speaking about today about the injury, is the acromioclavicular, which runs from the clavicle to the acromion process. So getting into the kind of mechanics of this injury occurs right here to this ligament. And so this is more of like a stabilizing ligament and a little bit of a stabilizing injury. And so a lot of times this injury occurs when there's any type of force that comes down on the shoulder joint, coming here, which kind of irritates this guy and in turn irritates these two as well. So there's many different ways to talk about this type of injury when classifying it. It could be a dislocation of the scapula or the clavicle. It could be a sprain. It could be a separation. Those are all the time that talking about the same thing when it comes to this injury. There's three most common sprains when it comes to this, and that's grade 1, grade 2, and grade 3, whether it's a sprain or a tear. And the first grade is when there's just slight tearing here and pain in this ligament area, where it's just, there's some slight tears, but it's not completely separated. That's a grade 1. A grade 2 is when this guy is completely torn off and there might be some tears to the secondary ligament. This might have a little bit of displacement of the clavicle, might raise just a little bit. And then the grade 3 is when this guy is completely torn, this guy is completely torn, and there's 100% displacement of the clavicle superiorly, just leaving the scapula. Talking about grade 4, grade 5, grade 6, the more extreme and critical grades of this injury. Grade 4 includes when the clavicle actually dislocates posteriorly into the trapezius muscle, and that's when you see a lot of blood as well. And grade 5 is when it dislocates too far superiorly, where it's just not even close. These guys are done, these guys are done, and it's just you're unable to move, or it's extremely painful. And grade 6 is actually when it dislocates inferiorly and actually drops below the coracoid process, and you have that clavicle sitting down here, which is also extremely painful and is in need of surgery ASAP. So getting into signs and symptoms of this injury, the signs is something that you can tell, and right away you can tell if this clavicle is displaced superiorly. If you see anything sticking out of the shoulder, you know for sure that this is this type of injury. That's a sign. Another sign could be internal bleeding, whether it's blue, purple, or red, just kind of in this area. Some symptoms that you might expect from this injury can include numbness and tingling in the area, as well as just unable to move, and of course experiencing lots of pain. So assessing this injury is pretty simple and fairly easy for orthopedics or any type of staff in an emergency room. If the clavicle is dislocated either superiorly or posteriorly, you can definitely tell that it's this type of injury, and also any type of pain at that site is usually a great way of assessing that this is the type of injury that you're occurring. Some acute treatment for this type of injury, first and foremost, would be to decrease the pain, whether that's by medication or immobilizing. And when you immobilize it, most likely you're going to be put in a sling just to stop that shoulder and the humerus from moving about that joint. Secondly, a type of way of treating this would be to kind of hold the clavicle down if it's about like a grade 2, grade 3 type of tear. That's in order to decrease the distance between the scapula and the clavicle, and try and take these guys and hold them together to promote some healing and just to decrease the amount of dislocation from the clavicle. When it comes to surgery with this injury, if it's grade 1 or grade 2, as long as this guy is intact, which would be a grade 3. If it's not a grade 3, you're not going to need surgery, only because if this guy will kind of hold it down, so it won't be too much of a difficulty when you're doing athletic movements or weightlifting at all. But if it's a grade 3 or greater, a lot of times you're going to need surgery, and that surgery includes going in and drilling into this guy, the clavicle, and kind of holding it down to that coracoid process in order to make sure that joint is stable and holding that clavicle down.